Welcome back, everyone. September is Suicide Awareness Month, and Arizona's family wants to put a spotlight on such an important issue, our kids' mental health. Suicide rates among young people have gone up about 60% in the last decade or so. Teen girls are also feeling more sad or hopeless. Experts are calling it a public health crisis and say constant exposure to social media may be a factor here. Joining us now for an interview is Dr. Vince Callahan. He's with the nonprofit research organization Florida Institute for Neural Discovery. Dr. Callahan, thank you so much. We know this is so important for everyone in our community.
Thank you for having me on the show. It's great to be with you.
Of course, thank you. So one of the big questions is social media facing its own tobacco moment. Can you just explain a little bit about what that means?
Sure. I'm old enough to remember when the cigarette commercials were on TV and they were supposedly good for you. Cigarettes were fine and tobacco wasn't a cause of cancer and everything was good, but we found out obviously the reverse of that. And I think we're finding the same thing out with electronic devices, electronic parenting. We've given to the young children the tablet or the screen as an electronic pacifier, and we're seeing developmental problems, we're seeing issues in the brain, and we're seeing kids now on a screen anywhere between 4 and 6 hours a day.
And how much time should they be spending on social media? Because as adults, it's hard to put down the phone. So much of our lives are on screens these days.
A healthy balance is 1 to 2 hours a day. And I've been asked many times, well, how old do you think someone should be before they get their first phone? My answer to that is realistically late middle school, early high school. And I say this kind of tongue in cheek. A 9-year-old doesn't need $1,000 iPhone. They're not that busy and they're not that important. But I know parents want to have, contact with their kids. Okay, get them a flip phone because it really is hurting them developmentally. It's hurting them communication-wise, social skill-wise, and problem-solving. So we're seeing some really adverse effects to this much screen time.
I think about this a lot. When I was in school, when many of us were in school, if you didn't get invited to a party, you didn't really see or hear about it until you went to school on Monday because we didn't have social media, you didn't have Snapchat. But how can that exclusion really impact their self-esteem and seeing everyone else live their lives also on Instagram and through all these other outlets?
Well, what you're seeing is actually the reverse to be true, where kids who are on the screen so much actually have a lower self-esteem and develop more issues with depression than those that are not on the screens. Because if you're not popular already and now you're on the screen, but you're not popular there, that's a double whammy, so to speak. And so you're really fighting with depression and low self-esteem, even if you're on those screens. So it's a real serious impact.
And real quick before we go, bottom line, what is your best advice for parents who are trying really hard to limit that screen time when we know it can be so difficult?
I tell parents, don't try to take the screen away all at once. You're going to get the adverse reactions like you would with a drug addict. My advice is 1 hour a week for the family with no screens. 15 minutes a day, 4 days a week. Put the screens down. You'll change the entire culture of your family.
Okay. Get out the board games. That's a very easy way to think about it. So, Dr. Callahan, thank you so much. We really appreciate it.
Thank you.